Hi, this is Dr. Mercado here at Orange Safe Dental, your local dentist here in Downey. I get a lot of questions about dental crowns, what they are, what they do. So I want to spend some time answering some questions, common questions that I get about dental crowns. So dental crowns are pretty much anything that covers your entire tooth. So some people call it a cap, some people call it a crown, a helmet, but a crown essentially goes over your entire tooth when it's maybe worn out, chipped, a big cavity. It just covers your entire tooth. So there's lots of things that we can do that are alternatives, something we can do differently than crowns. Unfortunately, all those things that we do tend to sort of be patchwork, so we kind of patch things up. Some people call it like a Mickey Mouse type of situation, right? When you cover the tooth up. But the idea here, most of the time, if you need a crown, it's kind of a bad for your health, bad for your tooth to do something else. So there's quite a bit of dental crowns. Some of them have to do with if they're temporary, how long they will last, so to speak, and also the materials. So there's about 4, 5, 6, depending on who you ask, different types of materials that we use for dental crowns. They go all the way to something made of plastic, metal, and then something that's a little more of a tooth colored, right? So some of those advantages for those, obviously, if you need a crown, maybe something temporary, it's good because it's going to help you keep your tooth for a while, but then it won't last very long. So that's why we have materials that last longer and will look better. So one of the questions I get is, doctor, do I need a crown after my root canal? And for the most part, I would say 95, 90% of the time, you do need a root canal. So you need a crown after a root canal. And the reason why is because teeth break. After a root canal, the tooth becomes very brittle over time. And if you don't have that crown protecting it, it will break. So you do need a crown after a root canal. So the dental crown procedure is pretty straightforward. It's pretty simple. It's pretty much a 2-step process. First, you get the tooth ready, kind of shape your tooth. We take a mold of your mouth, of the tooth itself. And then second step, we put the crown on your tooth. So one of the things that we can take care of things now in the office is not have a lot of pain in the office, or as far as procedure-wise. So we can definitely do crowns without causing pain and make it as comfortable as possible. So there's a couple consequences. One big consequence to getting a dental crown. And it has to do mostly not because of the crown, but if we don't take care of the crown. If the crown, as far as getting checkups, cleanings regularly doesn't happen after a crown, yeah, you might be in some trouble after getting a crown. But for the most part, there's very little consequences to getting dental crowns. So one thing that happens every once in a while, kids need dental crowns. And this is important because those baby teeth, like I call them, they have to last long enough to keep the space saved for the adult tooth that's going to be coming in. So if you ever have a situation where a kid or a child needs a crown, it's definitely something that needs to get done. So a good thing about crowns, you can't really get a cavity on a crown. The crown's not really alive and there's no real chance of cavity. However, if we're not taking care of the regular stuff, the checkups, the cleanings, you can get a cavity on your tooth farther down below the crown, so to speak. So you have your crown and then down below you still have your real tooth. And that's the area that can get a cavity. But if you get it clean regularly and check up regularly, that usually doesn't ever happen. So a big thing here and a big question I have at the office, Dr. Mercado, will the crowns look like my natural teeth? Do they look like a tooth? And we've unfortunately all seen some people that we know that they have crowns, and they definitely, you and I know they have crowns, right? So fortunately with modern technology, modern materials, we can definitely make teeth and crowns in this case look sometimes even more natural than your own teeth. Taking care of those crowns is pretty simple. How we take care of crowns is basic cleanings and your checkup. If you do that, that's pretty much all you have to do. You brush them, you floss them the same way you would do your regular teeth. No other changes at all. So one thing we want to happen with crowns, we want them to last a long time. And that's just the case. They can last a very long time. If you're doing your checkups, you're doing your cleanings, the crowns can really, really honestly last the rest of your life. One thing about insurance, they can cover dental crowns. For the most part, they won't cover the entire amount. It sort of depends on your insurance, your employer, the benefits you have. But some insurances do cover crowns, not all of them. So if you ever need a dental crown, you can definitely call us. We'd be happy to help. So I hope I've answered all the questions you've had about dental crowns. If you have any other questions or you need to take action and get a dental crown, give us a call. We're here at 562-659-7246, and we're here to help. Hope to see you soon.